Yep.
You can? Okay, great. So then I'd like to call the August 12th Health and Human Services Committee meeting to order right now. I think, Jamie, we have to start with a roll call because we're on Zoom.
Yes.
Okay.
Legislators Abbott-Keenan.
Here.
Chase.
Here.
Cody.
Here.
Bush.
Here.
Kenny. 4 absent, or 4 present, 1 absent.
Okay, I'd like a motion to waive the reading of the minutes from the previous committee meeting.
So moved.
Peggy, thank you.
I'll second. Deb.
Thanks, Deb. All in favor?
Aye.
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 Thank you. I need a motion for an approval of the minutes from the last meeting.
So moved.
Thank you,
I'll
Ken.
second.
Thanks, Peg. Any discussion? All in favor? Aye.
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 Okay, so now we have item C1, and we have Rich Gazarowski joining us today. Thank you so much. And I see Amy on the left as well to discuss foster care and specifically how it's going during COVID and also any other concerns before we get to the budget coming up. Thanks for joining us, Rich.
Thank you for having us. So I think to put everything in context, I want to give you a little bit of background about investigations because that's where most of our foster care placements come from. So back in March of 2020, pre-COVID, we were working with approximately 833 active CPS investigations. Okay, during the lowest point, during COVID, our lowest point of active case was around 300. And now as of August 5th, we're back up to 508. So you can see that, we're slowly creeping up there. Again, everyone's concerned that when COVID hit, we didn't have enough eyes on children in our community. The teachers weren't there, the community's supports weren't there checking on kids and making any type of concerns or reports that they may have. So during this time when COVID hit, we, as the Department of Child Welfare, we put together a couple responses to it. We had an emergency response team where we rotated 5 to 10 people in the field every 5 weeks. So people would be working at home on their cases, but actually only being exposed in the field for a week every 5 weeks. So we went through that, and we were well positioned to be quite honest with you, to work remotely due to our Northwoods contract that we did which is basically a mobile technology for us, which allows us to see case records, scan releases into our system automatically, send them automatically to the providers, and really cut down on the time of running around delivering a piece of paper. So as we move through all of that, then we got into the permanency realm. So we're a foster care, where you guys want to talk about. So back in February of 2020, we had 512 youth, and as of today, we have 542. So you're probably asking yourself, why is the increase? What's going on? What's happening? So you know that when COVID hit, the family courts shut down for a period of time, for actually a lengthy period of time. So youth, and we're still coming into foster care, but they weren't leaving foster care. So when the court shut down, if a child had maybe 1 or 2 more unsupervised visits before they were ready to be discharged home, all that came to a screeching halt. So with Amy coming on board and Jim leaving, we were finally, in COVID, working ourselves through the COVID response, we were able to get some of our supervised visitation back up and running. We're probably about 80%. And the courts are slowly opening back up. I mean, they're open, but the volume of cases that they're hearing is a lot less than normal. So, and Amy did a great analysis that I'll let her talk about.
Hi. So I'm going to talk about some numbers, the dollar amount, and comparing it to last year point in time, year over year. Because the foster care account projection through the end of the year is quite substantially over budget, at about $4 million, I believe. mostly due to the fact that the kids are not being moved out. So last year, if we look at the first quarter of the year, the 2019 January through March, foster care expense was about 7.8 million, whereas January through March of 2020 was about 8 million. So that was an increase about 3%, which is relatively normal. But then when we jump to quarter two, April, May, June in 2019, the foster care cost was about 7.4 million. And then in 2020 for quarter two, we're looking at a cost of 9.4 million. So that's a 27% increase in costs for quarter two, 2020 over 2019, due to the fact that kids are essentially stuck. And then looking at the numbers of the 542 that are in care right now, we have about 67 that can be moved out, that with the court slowly opening up, we have 12 up for adoption that are slated to be adopted. We have 9 kids that are awaiting official kin gap. We have 37 kids that with the judge's order could be released home. They're finishing their services. And we will have about 9 youth who are aging out by the end of the year. So that would actually put our number at about 19 fewer at this point in time over last year, if those kids were able to be moved out of foster care regularly. Another just general point increasing in the numbers is raise the age. When juvenile justice youth age 16 or 17 that normally would have gone through the criminal court system are now in the family court system in place. Those are in our numbers as well, just the general increase in foster care numbers. But something important to remember about those is the outcomes for them are better coming through family court, and they are 100% reimbursable through raise the age dollars. So even though the costs are higher, we are getting that reimbursement. And we've also increased our unaccompanied refugee minor youth slots in the county, so that we have more unaccompanied refugee minor youth coming into the county and providing those youth with services and transitioning to adulthood. And those costs are also 100% reimbursable by the federal government. So those are 2 things that are increasing our numbers, but are actually not a negative, because the outcomes are better for those kids in this system versus the JJ or not being, transitioned to adulthood, and they're fully reimbursable. So yeah, you kind of have to look at all sides of the numbers to get the full picture. But as Rich said, with the courts opening up, we're working, very hard to get these kids back to permanency, whether that's back home, whether that's an adopted family. And really taking a look with the Family First legislation coming into play next year of providing more preventive services for families in kin gap and keeping kids in their families, whether it's their biological parents or a relative.
Thank you so much. So you'd mentioned with regard to the budget, how over budget, we are due to the circumstances. How we know across the county that the county executives kind of asked everybody to, come back in this year, try to cut 20%. What is your plan? I don't know how else to ask it. How are you going to function, or what are you trying to do, and where, if you are being asked to cut, are you going to be able to do that?
So we've been working on our budget. We met with our financial operation folks yesterday and talked through things. That part of that increase was, you'll see it in the budget under the group home that didn't fully actually come to fruition. So the 4 million that's over budget, we can really back that out to 2, because that expense is not going to show up on the books. And then covering the other, we've had about 10 retirements, I think, from the incentive, and we've taken a really close look at things like supplies. With the staff working remotely, we can back down some accounts that way. We've taken a look at contracts and where we have duplicative services and where the outcomes are best for kids, and we were able to cut back on a couple services that weren't getting the best outcomes, or they weren't serving a large number of kids, but we also have other programs and services that can take on those kids. So not leaving anybody without the proper services. And I think we're pretty good we were able to maintain the pro forma budget numbers that the budget office gave us to work with at this point, mostly with salary savings and staff retirements.
Okay, and so the other thing that is just, it is what it is. It's a backlog in family court. Is there any priority measures or being taken to try and move these kids who are just stuck into a?
Well,
Hi.
unfortunately, the priority right now are the at-risk, the safety, and the risk measures. So the priorities are the kids in imminent danger or imminent risk, and those are going through the court. We're getting the removals when necessary and placement. It's the ones that are safe where they are that aren't moving as quickly.
Okay, thank you. Does anybody else have any questions?
Yeah, I do. At some point, will we get a report on the house that you're working or used from the Salvation Army? It was a while back. We voted on that, and we haven't heard anything more about it. And I just wondered, other than you just mentioned something in your presentation.
So the Sycamore House is not actually happening at this point, because once we started talking to the state and OCFS and speaking through the funding sources and the revenue streams, we realized that there was no way for the state to reimburse for any of these costs. We were preparing as if we were equivalent to a voluntary agency, and they said that they don't have a mechanism for county-owned boarding homes to reimburse, so there would be no state reimbursement. They said that there were potentially ways to be creative and look at multiple funding sources and multiple agencies, OPWDD, OCFS, and then COVID hit, and those creative conversations kind of came to a halt. So we put it on hold due to a lack of any definitive revenue stream from the state.
Do you know, does the county have any financial commitment with that property sitting vacant?
The county provided, Salvation Army is reimbursing for any capital improvements on the project, and the Salvation Army was providing some older youth in care therapeutic services through that contract that are being paid, but the services are being provided. But the actual property, not any longer, no.
So who owns the property then? Does the county own it, or does the
Salvation Army owns it.
Oh, okay. But we're not into a lease arrangements where we're paying them. Okay.
Nope.
All right. So very good. Thanks.
And we aren't into any situations where the kids are not in any place other than a home. Nobody is like in a hotel or anything.
Oh,
like
God,
that these
no.
days.
Nope, we've been able to address the high needs cases. We've been able to work through those and find them proper housing, and whether it's a group home or a foster family, and then really focusing on pushing in those services to keep those higher needs kids out of institutions and not have a need for using overtime in hotels and that type of stuff. Yes, we also have seen throughout COVID, actually, our numbers in institutions have decreased. We had 45 youth in institutional care, which is the highest level, most expensive level, and also has the least effective outcomes, I guess I would say. And we've reduced that from 45 to 40 youth in institution, and continue to try to move those youth out of institutions and into homes and community-based services.
So you've lost quite a few people to the retirement incentive. How are you doing with that? I mean, you didn't really have a huge staff to start with.
Mm-hmm.
How are you going to manage?
I think that we're going to have to be creative come this fall. One of, positive, negative, however you look at it, our cases are down right now. So the reduction in staff isn't affecting us as much as it potentially will in the fall when the kids are back in school and there are more eyes on kids and more cases are coming in. So we're really just trying to be planful and talking through ways to rearrange workloads and address immediate emergency issues with our investigators and then redistribute the cases as efficiently as possible. I'm not sure what that's going to look like. I don't know if
So I have a situation that I was made aware of and want to know how this happened. Apparently, an 18-year-old child was placed with a family, and I guess it didn't go well. And the kid ran away, but they weren't told that the kid had just gotten out of jail. Now, when you place kids, and I know 18 is really kind of pushing it, but when you place kids and they have issues like that, are the parents made aware of it?
So Peggy, maybe we can talk a little bit more about specifics, because this sounds to me like a raise the age, because we wouldn't place, child welfare wouldn't place an 18-year-old youth through family court unless they came down from raise the age. You know what I mean? So unless they turned 18 as they were being placed, I'm not so sure where, unless this child was in care for a while. So if you could give us some more information, I can get back to the specifics to you on that.
I'm going to refer you to Linda, who will let you know, because she knows more about it than I do.
Okay, thanks.
Thank
I'll
you.
actually be speaking to the parents later on today to get more details. But in general, if no matter the situation, but in general, do you have a cross-reference with the police department? Do you know when people are, like if a child were being let out and being placed, is there some way that you can check on that sort of thing?
I'm just trying to figure out how a child coming out of jail would be placed in foster care. Like, what were the circumstances that, because you'd have to go to court in order to be placed with us.
Right.
So I'm just trying to figure out. So again, Linda, when you get more information, we can walk you through it and get all the specifics for you, if you can give us some more information.
Okay,
You
thanks.
guys should connect off this. That would be, I think that'd be great.
Yeah.
Thank you for the information. Does anybody have anything else? Okay, Amy and Rich, thank you for the great work you do. We appreciate it.
Thank
Thank you,
you.
Julie.
Okay, we'll see you later.
Take care.
Have a
Bye-bye.
good day.
You
You
too.
too,
Good seeing
Peggy.
everyone.
See you.
Okay, so item number 2, we have our Health Commissioner, Dr. Gupta, joining us. And I would like to get a motion, and then we'll discuss for item 2A, which is authorizing a lease agreement with Bayberry Plaza for the use of Onondaga County Women, Infant, and Children Program. Can I get a motion? I'll move it. Can I
Deb
get a-
Cody, I'll second.
Okay, and now we discuss. So basically, Dr. Gupta had explained, and I'm going to have you talk in a second, Indu, if that's okay, but how they had been trying, it's an existing WIC building in Bayberry Plaza. It's a 5-year lease. There is a clause in there that if the money's not there and we don't have this anymore, that it will not penalize us, and the lease would, I think, go away. And it expired a couple of months ago. Nothing really changes with it other than just having to do this to secure the space and keep everything the way it is. Dr. Gupta, is there anything else that you can add?
Yeah, thank you, Chairwoman Judy Abbott-Keenan. I appreciate the opportunity, and to all this legislature body. Yes, so this, as you all of you know, that our WIC program, Women, Infant, Children program, is very crucial to do our work to empower and especially for the women who are living in poverty, to provide all the support, nutritional services for the infants. It not only provides guidance for them to have the good, healthy nutrition, but also kind of walks through does some testing and also connects them to resources. It has been at Bayberry Plaza for more than 20 years, actually. Prior to their current location, they were in Plaza near where the Kinney Pharmacy is located. This is referred to as what we call North Area Clinic. It is operational Monday through Friday and host evening clinic hours also on Tuesday to best meet our client needs. Week caseload approximately is a little bit over 9,000, and Bayberry site's load is normally 2,500 to 2,800, serving more than 1/4 of the total week clientele. So this area was selected because it's kind of serves the northern county, northern residents of the county, Liverpool, Baldwinsville, Clay, Jordan, but anyone in the county can go to any of our clinic. Most of the clients drive there, but however, there's a bus line, which is very helpful for the clients to go if they don't have a car. Furthermore, the other thing is Farmers Market is located every Wednesday from May to October, and WIC staff actually works to have that vendors available so they can get fresh food. So a lot of those things are pretty well functional, and it is a good location. We want to continue to have that. As you know, it's 100% grant funded. The fund comes from the feds to the state to us, and it has been in existence for quite some time. So we are asking your permission to support this.
Sorry. Okay. Does anybody have any other questions or discussion items? I think I let it on the agenda. I think it's important. I know I'd spoken with you, Dr. Gupta, about it being something that you guys have been trying to get done. And then of course we had pandemic, and you as a health commissioner have had a lot along with everybody else. So, and the 100% grant reimbursable little nugget on this, I think it makes it hold harmless for everybody. So anybody have anything?
Yeah, I
It's
do.
definitely something that is, it's essential for, as Dr. Gupta said, the moms and the babies out there that are especially in poverty. And I know that it seems like it should have been handled a few months ago, but there were so many other things that, we definitely have got to support this.
And also what we were doing with that is every program of ours actually talks to the clients about the COVID because the COVID is still here. So that is one other venue which we continue to touch, points, like touch points with our clients. So this is very important for us to continue to function in that facility.
Okay. Ken, did you want to add something?
Yes, I don't know that there's been a legislator that has not been supportive of the WIC program, and it's fully reimbursable. It's a great program, meets a lot of people's needs. However, to drop this on us not hardly 24 hours before we vote on it, I'm going to vote no, because I think the procedure is wrong. The program's great, but certainly COVID can't be a fallback for everything that we do in government. And so I'm just wanted to make that clear, that I totally support the WIC program. I just don't support this procedure. It's becoming more and more common with our legislative duties.
Thank you. Anybody else? Okay. So then we need to do a roll call vote. Jamie?
Legislators Abbott Keenan,
Yes.
Chase,
Yes.
Cody,
Yes.
Bush.
No.
Okay, so the
We are-
resolution passes. Is that everybody? Am I wrong? So you have 3 ayes and 1 no, and it passes. Great. Thank you. Okay, and now Dr. Gupta, we just have had a kind of a casual Q&A. We had a couple of committee members send in some questions and general concerns. And so Peggy, do you want to start? I think your school's questions specifically were very pertinent with some of the information that's come out yesterday.
Sure. I was wondering what your feelings are about the school opening things. And how involved have you been in that whole process?
So I have been very involved with that process. I just had actually a Zoom meeting with the superintendents less than half an hour ago. I have also further met with them before. During COVID time, we are of course doing Zoom meetings, but before the school closure, I have met with them. But then now at this opening one, they have significant guidance came from the New York State Department of Education under the purview of Department of Health. And our role as a local health department is important in terms of if there is a case and contacts, and also provide them any other guidance if they have any questions regarding any public health thing, and also making sure that they are the checklist. If you look into the detailed Department of Education guidance came out, it's like 145 or 55 pages. They have touched upon every area from the safety of staff, safety of students, environment, and then what are the protocols are going to be if there is a case. How do you do, they're supposed to know that how they are going to support or work with the health department with the case contact investigation. So a lot of those things which we have continued to discuss. The biggest, I think, take home message for this body will be the schools, we have a low infection rate at this point. Governor has allowed that, and certainly we are all in favor. Every school has come up with their own different hybrid plan, presented to the New York State Department of Education and Department of Health. Actually, they're supposed to send it, which will include not only their operation, but also involves testing as well as the case and contact investigation. So we are all in it together with them, and will continue to provide guidance. They are expected to have, if you look into their guidance, communication with the parents, communication with the staff. It was so funny that I don't call it funny, actually. It was so, I felt good, at least. I had a meeting with them before, and I pretty much have said it to them the same thing, and then the DOH, Department of Ed, the big document came out. So I just felt like, oh, that was good, because a lot of things which we discussed about how communication with the staff, communication with the parents will be so crucial, and engaging the kids, younger and older, and educating them about the mask, educating them about physical distancing, and having temperature checks at home. And if possible, I'm not sure how much they have the resources, but have that capability that everyone should know about COVID, because the more you know, the better you can handle it. And at the end of the day, one of those things which I think it should not be a surprise to you, like any place else, any workplace or anywhere where we are seeing, there will be cases in the school. It's not end of the world. It isn't, because you want to find out who the case is, who are the contacts, and isolate them and quarantine them. That's how we can continue to function the school and make a good learning experience. The first few weeks will be a little bit more anxiety provoking for everybody, rightfully so, because everybody's coming from different households, different kind of, we bring ourselves to our work. Whatever we do outside of wherever we are, we bring it to here. So once you have the sort of a cohort in the school, and the movement will be somewhat restricted, but at the same time giving them enough freedom for learning, that will, in few weeks, a few months, I think people will get more and more comfortable. And with the availability of all the things which I mentioned to you, we should be able to, I would think, keep the schools open. But the key to success is in people's hand, literally. Whether we are talking about our community, if we want our restaurants open, if we want our, any other like a community as such as open, and continue to have small gatherings controlled, and having physical distancing if you don't know them, and then making sure use a mask. It's called like it. This is like a little fashion statement, I would call it. So it is very important. It should be like a little bit, we are all going to take it and accept it. because it protects us, it protects others. And I say if I have to put a little bit motto here, I used to call that mask is to protect others, but a lot of times it may not resonate with people. They say, oh, I don't care, I am fine. But mask is for economy. Truly, if you think of mask equals to economy, that will go further, because you are keeping people safe and you want to have that opportunity for everybody to enjoy things. A little bit of a change of lifestyle will take us a long way until we have more definitive things regarding vaccine. Even with the vaccine, we will have a little bit time to see that how effective that is. Do we need every year new one, or is that one is forever? How is the antibody response? So a lot of those things are work in progress at this point. And the only thing which we have is literally in people's hand. If we want to have the college open, schools open, restaurants open, we really need to be responsible that we are playing our role. And that's what my biggest ask of everybody is.
So what about SU? How involved are you with that whole?
Very much so too. Yes.
Okay.
So I think the irony of this thing is I know everybody now in the community, all the leadership. You talk to them. I have become like a Zoom queen. I say it. Everybody, Zoom or WebEx. You are in this arena. You're talking to everybody, and you are reading lots of guidance, documents, research coming out. So those are the things, and then you're presenting to them, answering the questions and providing guidance and supporting their effort. And if don't agree, then express that will also. And they have been, all of them, I would say, that have been wonderful partners and very cooperative and asking the right questions and reaching out.
So what about, do we have posters or written information that we can distribute to the public? I know that there are the whole Westcott University area, really neighborhood committee is concerned about the new people moving into the neighborhood and not knowing what they ought to know about. I mean, I can't believe anybody doesn't know about it, but do we have any kind of informational things that we can provide for like the business owners and stuff on Westcott Street?
So, I mean, everything, as I mentioned to you last time, is we have put a lot of resources on our website, right? So at this time, I think what I would ask you again, to make sure you visit our website regularly once a day. You ask people to go through that. There are resources, put it in there. Those resources are taking you to for the employers, it's more of an OSHA side. We actually compiled as a health department, put the whole information as a guidance for anyone, which is applicable to actually anyone, including schools. The schools are a little different, but overall functioning of a operation of a facility for the employer and employee and staff is same principle pretty much applies. That how do you protect yourself, how do you protect others, and how do you do good customer service, right? So you need to be healthy. The people who are coming, they need to be protected, as well as you need to get protected from them, as well as what kind of environment you are. These are the three big principles. If we follow, those are highlighted in our resource section. And there are also for the school reopening. If you go to I'll be happy to share our screen and then show it to you if that is something you would like to do. That's up to you. I can't hear you. You are on mute, Peggy.
No, that's good to know. I mean, because we do talk to people about looking for answers on the website. And
we also have FAQs there. We are going to put more FAQ for the schools. We are in a process of making it. So for the parents, that will be specific. But people have to go and visit, because there's no other way to communicate at this point other than, we put everything. So I want you all to promote that. That is important.
Yep.
So, you can put your own website link to the health department COVID page that takes you directly there. So I think it's important. to do. And in terms of when you say that the employer, yes, if they are moving in the neighborhood, so SU, a lot of times these are SU students, so they have been very, very strong in terms of implementing and enforcing and providing guidance to the students and the parents. The one thing which we have recommended as the travelers are coming from those states where there is high rates of infection versus our community which has low rate of infections. So by governor's executive order, they are supposed to be in 14-day quarantine, and those 14 days quarantine will happen if we know where they are coming from. So airports are easy because people have to fill in a form, or the airline will ask them to go online and then fill out that form. So the contact tracers with the state actually has them, who gets that information, and they enroll them in text monitoring. The same thing is not true if people are driving from different places. So what we are asking, what I had asked the school to promote that website for the online form, if they're driving, they all have to enroll so that they can be monitored for 14 days. And that's what they have actually adopted it. So a lot of it, I think SU has been pretty strict. However, nothing is perfect, as you know. So as the neighborhood businesses, if they see something, they can put posters, they can print out a few things and make sure that they promote culture of masks, culture of physical distancing. You know, all these things are important. Yes, some people will get mad, but most of the people actually like those things because everybody wants to protect everyone.
So for the parents that come from states where they would have to be quarantined and just come and drop them off.
Yes.
And then go on their merry little way. Do we follow them?
So the New York State, so SU actually follows their own. And also if they signed up for that, if we know, so we don't have capacity in the health department to do because we are doing case investigation and contact. So New York State Department of Health, through their contact tracers, which we work as a separate arm with us, they are like our partner. They enroll them through their system, as I was mentioning, that online form, which they can sign up, and then their contact tracer, they call virtual contact tracer, they will contact those because you need name, you need their date of birth, and you need their address and a phone number. So they text them and they get enrolled into texting, most of it. And they are supposed to be in 14-day precautionary quarantine. It means monitoring temperature twice a day. If they get symptoms, they get tested. We have situation in which we have seen that some people turn negative, some people turn positive. So just that is working actually for the most part. Could that be some people we don't know? Yes, that of course is a possibility. But there are a lot of processes put it in place, starting from state, from the local, and adopted by the colleges.
Okay, I wanted to ask you, in reference to testing, we're going to have all these kids in school, rapid testing, where are we at with that? Are we going to be prepared and able to accommodate what potentially could happen?
Right, so the testing is it's a work in progress. County Executive's Office, Ann Rooney, Deputy County Executive, she is working with the emergency management and myself and with other partners like Upstate and some other places to ramp up the testing capacity for the schools. So like, for example, in superintendent's calls, which I mentioned to them, they need to do two communication. One is communicate with the parents. So parents need to have an option if their pediatrician or family physician can do the testing. Some of them have capacity, some of them don't. My own conversation with some of the large family practice groups or some of the physicians that they are looking to have rapid testing in their offices for not only for children, but also for their patients in general, because the more you test, you can find out if you have a common cold, you have a flu and all, you know, all these things, they are in a process of doing it. Some of them might have adapted it. So having a conversation with the pediatrician or family physician is very important. and put that process in place. If the school tells you, you need to be tested, where are you going to go? Are you going to go with your pediatrician or your family physician who may have capacity? That's great. But it should be done in a shorter time. Results shouldn't be waiting for 7 days. The second part is we are looking to expand the capacity with our partners in the community. One of them is upstate, to see how we can connect the school system in which they can sign up and get the testing done. So it's a work in progress at this point. And there are other things we have talked about at this point. We're looking if there was be pool testing available, like a large pool. So you can have like a classroom tested. So you have 22 or 24 kids and the staff tested in one pool because that's the cohort. And if they're negative, that's good. And then you go to the next one. And if they're positive, you go and find out of those 24 or 22, who was positive, and then you can isolate. But that process, it's still work in progress. So these are all conceptually being done. Some of them are kind of halfway through, some of them are full there. So testing is important part of that. Considering we have low infection rate here, we keep our fingers crossed, is people's attitude and not being complacent is the key to our success. We want to be Central New York, Onondaga County unique, that we want to be in a national somewhere, that we kept it good, right? So it's people's power. That's what I would ask everybody to do, that. Virus doesn't just jump in the air just on its own. It needs people to transmit, right? So our behavior is the one which empowers or can kill virus.
Thank you. Anybody else? Deb, I know you had a couple of questions.
Well, I was going to ask about the state restrictions on travel and who was tracing those folks. But I think Dr. Gupta, you said that the state continues to track those folks, and that doesn't put an additional burden on our health department. Is that correct?
That's correct. And as I mentioned, so they get, depending on, they have been doing throughout the state. In our county, I know one time they said that we had 600 people came to Onondaga County. That can vary depending on how many people. So they do put them in quarantine with the text messaging, and then also can give them an order, which I have authorized them to do. And if somebody has any symptoms, then they transfer it back to us at that time through the electronic, that's the case management system called ComCare. And then we schedule for testing and then connect with them. So that has been the process, and there is always a daily conversation with them. So they are sort of an extended arm of ours, which we appreciate it very much, because they work alongside with us.
Okay, great. Thank you.
Any other questions?
Julie, can I ask a question?
Go ahead.
Dr. Gupta, for the contact tracing for all of the schools, as you find, I guess I'll back up. Another quick question. If you do that as you're developing the pool testing, if a particular cohort or pool tests positive, so you got somebody in there, what happens to that cohort during that time?
Right.
How would that be managed?
So that's the thing which I am trying to get to, that because we need connectivity from positive to identifying the case, right? So it's very easy to do quarantine the whole class. That's great. We will do that at that time. But we also need to know who is positive in that pool, because then we have to trace that person, not only in the school. School is relatively easier because we actually identify that group for the short time, and within 24 hours, 48 hours, which we don't find who's the individual, that kind of purpose sort of get defeated, because we have to find out this kid or a staff where the other path was out of the classroom, i.e. house or in the lunchroom or different places, right? So that is, those two processes have to be one after another one. That's why it has not gone that far yet. But the pool testing is, there is Quest Diagnostic is approved for people testing for 4, because they can test individually. Right now, there's surveillance testing you can do without knowing who that is. But my question has been, I want to know from your surveillance to how do I get to a
You
specific
catch it.
point,
Right.
right?
Right.
So
That makes
it's a work
sense.
in progress. Yeah.
And the health department will do the contact tracing for all the schools. We have enough staff to do that for the whole, for
So
all the
health
schools.
right. So I will share, we are in a process of making, I just presented to the superintendents too, that anytime the standard process of case investigation is, interview the case, identify the contacts, kind of walk through the path, and then interview each contact. If there are 2 contacts, there are 50 contacts. What we use is the help of the contact tracers of the New York State Department of Health. That's how they expanded our capacity, what we call surge capacity. And that's how empowered from the Bloomberg philanthropy it has come, and that has been given to state, and state has been provided all the local health department.
Right.
That has been God sent at this point, because we certainly wouldn't be able to do that.
Right.
And so we work in concert with them. We identify all those, and then partnership with the schools and the colleges is so important, because they are the people on the ground, right? They have their
Right.
staff, they can give us a lot of information. So we need their partnership ongoing. We always have that, because this is not the first time we are doing communicable disease investigation. When you're talking about mumps, when you're talking about pertussis and measles and TB, we all have been there. So their health staff is very familiar with all these things with us. This is not a new learning. I think it's a little anxiety, because it's a new virus. So
New. Right.
yeah, so that will continue. Yes.
Thank you.
Much. So the last point that I just wanted to bring up was a totally switching gears, but it's still in the purview. It's the Tripoli watching the mosquitoes and spraying that's going to happen. I believe is today Wednesday, starting today.
Yes.
Yeah.
Yes.
Yes. Okay.
Yeah.
So just to make sure everybody knows that. Did you have anything to add on it, or?
So I just wanted to remind everyone, I think, is that even though COVID is happening, and as Legislator Bush was mentioning, is we actually continue to work in every single way, whether it's our communicable disease, whether we have syphilis, HIV, or whether it's a home visitors. They're not going to the homes. We are doing the phone calls. We are doing the telephone visits. Environmental health, which does the mosquitoes, sewers, and restaurant inspections, temporary residences. I mean, the name. And then also we have other lead programs started to do inspections at this point. We are doing a lot of things, and we are trying to be creative and trying to do outreach. Cancer services, I meet with my staff on a regular basis with the team, and we were actually talking about that, how do we do outreach with the cancer services program. And I know Deb was there, Legislator Cody was there last time when we did the cancer awareness, and we had wear the pink on this kind of thing.
Yes.
We were just trying to figure it out. How do we contact the community members? We do the outreach. So, a lot of those things is, in this era, we are trying to think of being creative. And some essential services we are going to continue to do, as environmental health is our regulatory one. The tobacco, the TUPA, we have for the T21. So how do we enforce all these things? A lot of those things we continue to do. We just don't say it out loud. We just try to figure it out. Now, in-person visits have been more feasible at this point. We're still trying to be, very cognizant of protecting our staff, as well as protecting the community. So the work continues. The same as WIC program continue to function. They did the state limited that in person quite a bit. They were doing telephone and continue to reissue the checks and provide the counseling. Now we are kind of going to little by little expansion of everything. So work never stopped for our point of view. We just have to, prioritize things, how we do that, but not at the cost of other things. So I just want to reassure you all. And when mosquito part came, we do mosquito count. So when my director came and said, some of the health department actually have opt not to do because they couldn't have that resources. And I said, listen, we have Tripoli in the past year. We are going to find little resources and keep on doing so. They stretch themselves quite a bit and doing the counting and then unfortunately, we found EEE again, and we are going to do a spraying. But at the same time, we do the protection, right? Don't go out and without the full sleeves and all those things. So when I go out, I will go the full gear if I go into the woods and different places. So the work of the health department continues. So I can reassure you that.
Can I ask a quick question since you opened the door on everything else you do? Where are we at with Lyme disease? Because speaking about going into the woods, have you? I know you've continued to do that. Has there been an uptick? Speaking of ticks, in Lyme disease.
So we haven't seen any uptick on any of the typical things at this point. Our main concern becomes, when we see, not you want to hear it, but sexually transmitted infections. That's what we see, because a lot of times is the prevention and all those things. I think the clinics were different places. The physicians' offices were closed. Everything was.
Right.
And people, but right now, we have seen kind of level off. And once the physician's office open, then they will see more patients. Then they are going to report more Lyme disease. So it's a reporting. It's a lot of it's a reporting. So unless it's reported, then we won't get it.
Because I see so many more people are outside now,
right,
in the woods. And when I go to Green Lakes, every single time I'm talking to parents about not letting their kids run up those hills, because that's the highest constant density of ticks.
Right.
In
and what
this area.
cringes me the most is when people go into the woods with the shorts and tank tops and
kids
with the
flip-flops.
Flip-flops, and I'll say no, that's not appropriate. When you're going there, cover yourself and then check yourself. I mean, I follow, even in my grass, my daughter was just walking with the barefoot at times. I said, check your feet when you come inside.
Absolutely.
So you just get into
the state probably should have more signage out there about ticks, actually. Anyway, thank
probably.
you.
Yeah, thank you.
So can I ask one more?
Sure.
Okay. How are you doing with staffing? How many people did you lose to the early retirement incentive?
Gosh, I can't remember. We lost few retirement, and we are requesting to fill some of them. If we can reorganize some, being fiscally responsive at the same time without jeopardizing public health, that's the goal. And that's how I will present my budget to the county executive and to all of you. Being responsive at the same time, without health, there's no wealth. So a lot of times it's finding the balance. So that's, we will need to refill few of the people, and that's what we'll be requesting. Some of them we can reorganize. So we will do various tier budget, but at the same time, without compromising, that will be our goal. That will be present.
Okay, just let us know.
Yeah, thank you.
Thank you so much. Oh, we appreciate your time. Godspeed, Dr. Gupta.
Thank you. Thank you.
Okay, so I just need a motion to adjourn.
I'll move to adjourn.
Go ahead. Okay, great. So that's Deb. And second, Peggy?
Yep.
Awesome. All in favor?
Aye.
Aye.
Thank you, everybody. Have a great
Thank
week.
you.
Stay safe, stay well. Take care. Bye-bye.
Bye, Dr. Gupta.
Bye.